Hello, welcome to today's webinar hosted by the European Network of Youth Cancer Survivors. This is our fifth webinar, and we are very excited to spotlight the topic of social challenges in follow-up care today. And we are really excited to have such a diverse audience today. There are many survivors and carers, policymakers, healthcare professionals, patient organizations, and many others from at least 29 countries. So that's really great. Welcome to everybody. So what's our program today? You will hear exciting contributions on various aspects of social challenges. And of course, we are also looking forward to your questions and comments. So please put them in the Q&A section at any time, and we will come back to them after our speakers or in the panel discussions at the end of the webinar. But before we get started, let's move on to our first poll. So of course, we again want to know what you think. The first question would be, how important do you estimate social support for young people living with and beyond cancer? So please pick up your mobile phone, your device, and just you have the QR code here, or you can enter also the Slido code. And then please tell us what you think. How important do you estimate social support? Oh, that seems to be very clear so far. We just wait for some more people to reply. Yeah, I think this is really, I would say, very much in line with what we believe, which is that really the social dimension is central to our lives and our health. And yeah, 100%. This is really nice. So thank you for your opinion. And this leads me straight to our second question. Yeah, thank you, Asta. What social challenges do young people living with and beyond cancer face most frequently? So this is a multiple choice question. So is it mobility, education, work and employment, social network, insurance, financial issues, housing, residence law issues, or other issues? Again, what would be your opinion? Okay. So we see we have a lot of responses for work and employment, but also education, social network, financial issues. Yeah, so work and employment seems to be really important. And otherwise, I think the answers are really quite evenly distributed, which I think also shows us very well how complex this topic, how complex the social dimension is. Thank you. Yeah, that's really nice to see. And with this in mind, I am very pleased to introduce our first speaker for today, Kerstin Krottendorfer from Vienna, Austria, who has worked as a clinical social worker in acute and follow-up care for many years. And she is also a researcher, particularly on social assessment, social diagnostics, and also transition. Yeah, and she's also in the EU CAIASnet project involved in the project. So she will tell us about the central role of the social dimension for quality of life. So thank you very much, Kerstin, for being here, and the floor is yours.
So Well, thank you very much for your nice introduction, and good afternoon also from my side. So I will check if I can go through yes, perfect, sorry. I just want to test. So I'm very happy to talk the next 10 minutes about the social dimension of childhood, adolescence, and young adult cancer survivors from my perspective as a clinical social worker. Most of you know in which way the social dimension is affected after an oncological disease from your own experience as a patient or a family member, or the healthcare professionals from their daily work. Using a case study and selected literature, I would like to show the complexity of this topic and why it's important to addressing the social dimension also in aftercare. As an introduction, I want to start with a well-known model, the biopsychosocial treatment model, a multi-dimensional approach for health and illness. In addition to the physical aspect, the psychological and the social aspects must also be taken into account when considering health and illness in general, and of course for oncological disease. So these three dimensions influence each other and are in constant interaction. So for example, the neurological problem, ataxia or balance problems in aftercare of a neuro-oncological disease can affect the mental well-being. The physical problem or burden in mental health can affect the ability to have social relationship and causes maybe social isolation. But social isolation can also have a negative impact on mental health or physical well-being. So from my point of view, it's very important to focus not only during the intensive treatment, also in follow-up care on an interdisciplinary approach with a biopsychosocial focus. So in the course of my practical and also my scientific work, I have asked myself in several times why the social dimension, from my point of view, is sometimes the neglected dimension. For example, in the most of the therapy optimizing studies, the social aspects are missed. So that's why it's important to me to make this perspective a little bit more visible. And to illustrate the complexity of the social dimension, I have created this graphic for you based on literature. And this graphic has not claimed to be complete at the moment, but it should be a little bit more visible what's the social dimension. And the graphic is divided in 4 fields for the moment. So first of all, you can see the socio-economic factors with the educational level and the employment. You already say that's very important. These aspects were already addressed at the last webinar last month. Another aspect is the legal status, the insurance, the welfare issues, as well as the material living conditions, which means the financial situation, and the living situations. The socio-ecological factors, so the second one, for example, are the environmental factors and the mobility, for example, the accessibility of healthcare facilities. The third part is the socio-cultural factors, including the language, the country of origin, the ethnicity, the religion, as well as also the health promotion and health-related knowledge. And the last aspect is the social relationship, the social network, and the social support. So all of these levels can interact with the physical and psychological aspects. However, all these aspects can also be affected by the oncological disease, or conversely, these aspects can have an effect on the health, on your health, the treatment or late effects of the oncological disease. Now I would like to make it a little bit more practical with a case. So a 25-year-old patient in long-term aftercare with a craniopharyngioma, with hormone deficits, fatigue, chronic headaches. So just to name some few diagnoses from this patient. Due to the increase in physical problems and the associated impact on mental well-being and the social dimension, we start then an intensive psychological and social work care for him. I, as a clinical social worker, used at the beginning of my counseling process a social diagnostic tool, the inclusion chart 4. You can see it on the slide. Together with the patient, I can assess the address of the social assess the areas of the social dimension, whether there are trends towards improvements or when it's getting not that well. This is the start for my social work intervention planning. You can see in the red marked areas that the participation in this area of the patients are limited. For example, the job market, the financial transactions, the mobility, and the social support, also the products of daily needs, and of course, the health is affected. In order to improve the different areas, I worked with the patient in the process of 2 years to improve his social dimension. So there's not enough time to go into detail about the specific social work intervention and the improvement achieved in the different areas. But this example should show the complexity of the social dimension and that in some cases a continuous support is needed. Also, these patients show us again and again over the whole process that the physical, the psychological, and the social aspects have an impact on each other. So the stress in everyday life due to fatigue could be reduced by strengthening the living environment support, for example, the organization help for cleaning the flat, or support by buying medication and food from another person from the social network maybe, and to be shortening walking distance through the use of disabled parking spaces on the educational place, for example. As a result, it was possible to devote more energy for a faster academic success, and the positive experience at the university in turn promote mental well-being and lead for faster existential security throughout their own income and more financial independence from the family. So you can just see that some effects there always influence themselves. But when I want to show with you in this case that it's important to work on all 3 aspects to achieve an improvement in health, including the social issue. And next, I want to show you some few studies that deal with the area of the social dimension. For today, I would like to go into detail in 2 areas: the living situation, so housing, and the partnership and social isolation, because the other big topic, the employment work situation, was addressed already last month. So let me start with the living situation. So compared to siblings of survivors, more than twice as likely they live independently. So compared with general populations, the survivors had higher odds of not living independently and also using social benefits. So some authors described some risk factors for dependent living. This includes the brain tumor patients, as well as patients with cranial radiation or patients with problems with attention, processing speed problems, or low socioeconomic status. For example, so survivors diagnosed with brain tumor have a higher rate to live with their family and significantly less likely to live independently. They need more involvement and support of their family for health-related quality of life. And the second topic I want to address today is the partnership and social isolation. Most of the survivors manage the social contacts in a very good way, but there is also a group which challenging with social relationships. Nevertheless, survivors live less often in relationships or are married. Also, they are older when they have their first boy or girlfriend. And apart from the partnership relationships, childhood cancer survivors are less likely to have friends or difficulties forming close friendship, and a lower likelihood of spending leisure time with friends. So review of Pal et al. Described some risk factors which contribute to social isolation. I just named some of them, for example, the physical limitations, the cognitive impairment, some sensory impairment, or some low socioeconomic status. And suitable for it, I would show you some social network map on the right side from the slide, from the same patient I was talking before. So the patient mentioned in the counseling process that he has less friends and there's a kind of social isolation. So that's why the social network map as a social diagnostic tool was used. And on this map, you can see 4 fields, which are divided into family, friends, colleagues, and healthcare professionals. And together, the patient and the social worker, they draw in the people in his social network he has. And the distance between the central point, you can see here in the middle, so that's the patient. We draw in all the network people. And you can see on the field that you can see on the field on the other side on the slide that there are a lot of healthcare professionals in the social network, and the other red circle are the friends. So the patient has only 2 friends. Of course, the number of friends says little about the quality of the relationship, but this must be ascertained during the counseling process. But for this patient's intervention to strengthen the network was very implemented, and we work a lot of the social network to improve it. So I hope I could give you in this 10 minutes insight into the theoretical and practical view on the social dimension, focus on late effects of childhood, adolescence, and young adult cancer survivors. And I want to summarize that an oncological disease leads to changes in patients' environment, and often the social dimension is affected also in aftercare. The clinical social work supplements the medical, the psychological, the nursing care with the aim of providing advice and support for problems in the patient's social environment and the social dimension. The aim must be to develop and to strengthen the resources of the survivors and their environment, and also to develop some special programs for the survivors and their needs. For example, some network opportunities to reduce social isolation, to strengthen the relationships, or also some project for living, or also for educational and career program, as we heard last month. So consequently, the implementation of an interdisciplinary biopsychosocial model in aftercare and long-term aftercare also to focus on the social dimension. So thank you very much for your attention, and I'm very happy to take some questions. So yeah.
Thank you so much, Kerstin. I think this was really a very comprehensive overview, how complex social challenges can be. So thank you very much for that. At the moment, I don't see any questions in the Q&A section or in the chat. So please don't hesitate to put all your questions or comments in the Q&A section, because we plan to have some time to discuss them either now or in the panel discussion. So both will be fine. But yeah, of course, Kerstin knows me as always. I would have one. Actually, Kerstin, what would be, listening to you, I ask myself, what would be your recommendation after all your practical and also research work? Who should get social diagnostic, social assessment, and also social counseling? What would be your recommendation?
So from my point of view, I think it's always very important to work interdisciplinary, and also because all of our healthcare professionals have a little bit of different focus. So you as a psychological, or me as a social worker, or the physicians have some other focus in aftercare. So when they're coming for the appointment, for the checkup, they focus on different things. So my recommendation would be that also the social dimension have to be a little bit more in the mind of the healthcare professionals, and it would be great that social workers also very to work integrative in the aftercare with the late effects ambulance, for example. I just can talk about Austria, for example. So it's not that common that social workers are working in the aftercare. So I think that's the first step, that they are included also there, because we can address other aspects and inform the survivors or the parents about some support possibilities.
Yeah.
Yeah.
Thank you. That's what we wanted to hear, I think. Yeah, it's so important to always address the social dimension and all the social challenges as like the basis for everything, right? And to have more social workers integrated in the teams in follow-up care. Okay, so the next thing will be, we really don't want to keep a really inspiring video from you about the right to be forgotten, which we will get into more detail in a few minutes, but we just thought that it's nice to start really with some visual impressions. Thank you, Asta, for starting it. Thank you. I think this really is the very best introduction for our next speaker, Tiago Pinto da Costa from Portugal. Have it again, but that's okay. He is a childhood cancer survivor and patient advocate at Acreditar, and he is really engaged in long-term follow-up care in childhood cancer survivors, the socioeconomic rights and topics related to adolescents and young adults with cancer, and he is involved in the European Network of Cancer Survivors as an ambassador. So thank you very much, Tiago, for being here, and the floor is yours.
Thank you very much. Always a pleasure to be here with you. Okay, so today, hello everybody. Today I'll be giving a little bit on an update on the right to be forgotten, as the video shown to you. Okay. So, as you might be aware, today medical advances in the diagnosis and the treatment of cancer allows that the majority of cancer survivors and the cancer patients to return to the life that they enjoyed before their cancer disease and diagnosis. But this may happen with the cost, and we know that some survivors are confronted with late effects of their cancer treatment, their disease, and that can also affect the whole organism and the psychosocial well-being. But in addition, these many survivors also face some socioeconomic discrimination due to their prior illness. These cancer survivors are effectively impeded by institutions at both private or public level for resuming a normal life following their treatment. And financial discrimination here refers to the unfair and unequal treatment of cancer survivors that they are seeking to financial services, and this discrimination because of their medical history. And these institutions can be, for example, banks, insurance companies. And so what happens is when they apply to some insurance, cancer survivors must disclose that they had a cancer diagnosis before in their past. And this results in the applicant of this insurance is one of the consequences is being denied the insurance or have to pay a high premium, which is significantly higher than for a person with other chronic conditions. This happens even decades after being given cancer-free, for example. So what do we mean about the right to be forgotten? It means and to end the ending discrimination against cancer survivors when accessing essential financial services such as the mortgage and life insurance. And as cancer survivors, we are facing a life sentence of being discriminated by financial actors with no regulatory oversight. So the survivors, we had the disease, and after some years past the disease, when you are trying to return to your life, you find out that you are a second time discriminated because you had a disease in the past, in this case, on accessing some financial services. So there should be some provided legal rights for long-term cancer survivors not to disclose to financial entities that they had been previously diagnosed with the cancer, and all young survivors should have the opportunity to access a fair insurance contract. Also, the financial services institutions, banks, insurance companies, etc., should inform these former patients and consumers of their rights. So now I'm going to talk to you about what has been happening and what has been done so far. Here in this map, I don't know if you can see it well, but these are the actual measures that are implemented to protect cancer survivors from the financial discrimination in the European Union and also in other countries and in Europe. And as far in 2023, 6 member states have taken legal measures to counter financial discrimination against cancer survivors. And this right to be forgotten, as we call it, affects survivors differently in the different countries. And for example, according to the provisions in France, the Netherlands, in Portugal, in Romania, these cancer survivors who had the cancer diagnosis occurred before the age of 18 or 21 years. It depends on the country. For example, 18 in Romania, 21 France, Netherlands, and Portugal. This would be forgotten 5 years after the end of the treatment. And for those who received the treatment in adults, their medical history would be forgotten after 10 years. For example, in the Netherlands, in Portugal, 8 years in Belgium, 7 years in Romania, 5 years in France and Spain. So it depends a little bit on the legislation of each country. And this is also always following the end of their treatment and without any evidence of relapse or recurrence. Other countries have also adopted non-legislative frameworks which take the form of, for example, conventions between the government and also the insurance companies and the banks. That happens in Luxembourg, for example. And also there are some codes of conduct that are happening, for example, in Ireland, Denmark, Cyprus, Greece, and Finland. And in some of these countries, for example, in Belgium and France, there are also some measures that were shorter deadlines, shorter than 5 and 10 years, can be established by an agreement between the states, also the financial institutions and the patients' organizations. So there are, for example, some reference tables with some types of cancer diagnosis that you can wait less time than 5 years not to disclose this kind of information to the insurance companies and financial institutions. Then what also has been going on is the Europe's Beating Cancer Plan, as you may also know. And in this big plan for Europe and for cancer, especially also for the cardiac cancer, childhood and adolescent and young adult cancer, we see here in chapter 4, the quality of life of cancer patients and survivors, a measure that says that there should be developed a code of conduct that will ensure that these cancer survivors will only provide the necessary and proportionate information related to their disease, to their past disease, when accessing this kind of financial products. And at the European level has been also going on, that was published in 2022, an explorative study on access to financial products for persons with history of cancer in their past as well. And more recently, there is going on a provisional agreement on the new consumer credit directive that I think some time ago it will be possible to do like a public consultation and to give feedback, for example, for patient organizations. And they in this directive on the consumer credit, there is also referred to the right to be forgotten. So now, most important for us, for survivors, for patient organizations, what can we do? So we should raise awareness about the financial discrimination of cancer survivors, of young cancer survivors. We can and should find out about what are the current laws in our country that protect the rights to non-discrimination of cancer patients and survivors. We should, for example, to be in touch with persons that have some testimonies about this kind of discrimination and that they have experienced any kind of financial discrimination. And we should sensitize policymakers by sharing these types of testimonies and also the good practices that are already implemented in place in the countries that I told you before, because sometimes this kind of these practices, good practices, they have the involvement of some cancer survivors as well, and also some patient organizations that help to be this law to be implemented, the law, the right to be forgotten. Then we can also accelerate the cooperation and dialogue between patients and policymakers. We see here two good examples, one at the national way, other at the European level, with a white paper that was presented in the European Parliament by also cancer survivors. And also at the national level, this kind of cooperation dialogue that we have with the policy makers. And by the end, we can also set the recommendations to all of these, and that could be considered to the current legislation, but also if there is no legislation, to a new legislation about the right to be forgotten. And also, as I used to say to everyone, we are better together. So please share your story with us here in the European Youth Cancer Network, and we will help you as well to help you with this advocacy work as well, and to give you the best tips and the best instruments. And you can always talk with us, because with these testimonies we can reach and we have a stronger voice, and then to reach this kind of good things, and also to fulfill these challenges of the survivors. Here are some resources that you can have, and you can read more about the right to be forgotten. So thank you very much.
Thank you, Tiago. This is really amazing work, what you did, and the whole group. So thank you very much, and also for the resources and for giving us also kind of a guideline what the next steps would be for countries, for example, without measures. So I guess many more will ask you in the near future, maybe. Any questions for Tiago or comments from the audience? If not now, maybe we can. Yeah, Anya. Sorry.
Hi, Tiago. It's lovely to see you, and thank you very much for presenting today. We are currently doing the ground preparation work to prepare the measures in Poland, and now, as we have parallelly spoken to our team, I would love to hear more how the process has started in Portugal, and it would be lovely to be our mentor here on that part. So thank you very much for presenting that very important topic for us as well. Thank you, Tiago.
You're welcome. Yeah.
And you can find, as you see, all the resources also in the chat. This is really helpful. Thank you. All right, then maybe we can come back in the panel discussion again. But now it's a pleasure for me to introduce Katharina. Katharina Roser. She is from Switzerland, and she's a lecturer and senior researcher at the Faculty of Health Sciences and Medicine of the University of Lucerne. She did her PhD in epidemiology and is a principal investigator of a project on adolescent and young adult cancer in Switzerland, and another project on socioeconomic hardships after childhood cancer from the perspective of the parents, the survivors, and the experts, also in Switzerland. So thank you very much for being here, and I hand over to you.
Thanks a lot. Thanks a lot for the nice introduction. I'm happy to be here and give you some insights in one of our projects we did and an ongoing project, so the second project you mentioned, Ulrike. Let me see how I can. Now I should be able to, yeah, good. Perfect. So I will start. You might know, or you are well aware that that compared to the medical impact of cancer, that the psychosocial needs and care after childhood cancer is not yet given the focus that it should have, and the social and emotional well-being is often not addressed in follow-up care. So this means that there are unmet needs of survivors. And if we know about these needs, we could address or better address potential social and emotional problems. And this is the basis for a mixed method study we did. And there we wanted to explore the experiences of survivors in Switzerland on their well-being on the one hand, on the impact of cancer, and on these unmet needs they might have related to psychosocial care after childhood cancer. Mixed methods means that we combine different methods. So on one hand, we had a so-called quantitative study. There we conducted an online survey. So we sent a link to survivors and they could fill in this survey online. And on the other hand, we had a so-called qualitative study. And there we conducted interviews with mainly survivors of childhood cancer and also, and I will present this shortly, afterwards with 3 experts from legal and insurance areas to also get insight into the perspectives of these experts and to kind of get a context on the needs that survivors were talking about during these interviews. Our study participants were childhood cancer survivors. They were aged at least 18 years. Diagnosed with a childhood cancer, and they had completed treatment at least 2 years ago and were German or English speaking and living in Switzerland at the time of the study. The online survey, so the one part of this project, was filled in by 69 participants. So the results I show you on health and well-being will be based on these participants. Almost 70% were female. They were on average 30 years at diagnosis, 9 years old at 30 years at study, and 9 years at diagnosis. So quite a time after their childhood cancer diagnosis. And of these 69 participants, 28 also participated in the interview. So the quotes I will show you are from the group of these 28 childhood cancer survivors with whom we conducted the interviews. So First, we had in the online survey that the survivors filled in, we had standardized questionnaires looking at well-being and so-called quality of life. And a fifth of the survivors that filled in the questionnaire reported a low health status in general. 13% reported poor physical health. Almost half of the survivors reported poor mental health, and about 40% were considered psychologically distressed. And this is based on items they filled in the questionnaires. And regarding the impact of cancer, they reported that as a result of having experienced cancer in the past, about a third changed to a healthier lifestyle, and also about a third took fewer risks compared to before their cancer diagnosis. And to the right on top of the slide, you can see a quote of a survivor on health and quality of life. And he or she was saying that you think differently about life, about health and quality of life. You don't take it for granted, meaning I don't take for granted that I'm doing well today. And I know that my feeling well today is not self-evident. So really showing the importance of being well and having a good life, good physical and also mental health, if possible. We also asked the survivors on the impact of cancer regarding different domains. And the survivors we asked described diverse impact in different aspects of their life. And in the figure, you can see the 3 domains we asked regarding impact of cancer. So one is the psychosocial domain. We labeled it so regarding insurance, education, and work. Then we had a social domain, looking at relationships, friendships, and family relations. And we labeled it with intrapersonal domain, so the ability to care and attitudes towards life. And what you can see displayed with the bars is that we group the survivors in negative impact. This is colored red, then no impact in this specific domain, and a positive impact regarding this domain. So for instance, you can see that for relationships in the middle of the figure that more than half of the survivors reported that their cancer had a negative impact on their relationship. On the other hand, in the interpersonal domain, so for the ability to care and attitudes towards life, and this we were very happy to see that 80% of the survivors reported that at least in this domain, they felt like that cancer had a positive impact on these 2 aspects of their life. And this is also a quote from one of the survivors in one of the interviews. So I think I move a little bit, how should I say, more relaxed through life, because I know I've seen how quickly something like this can happen, and that you don't have to be afraid of everything, but just do what you want. Of course, I'm working towards a goal. I want to achieve it, but still I just tell myself that if it doesn't work out now, then there are other things, and a bit of this ease has been given to me through this experience. So kind of a shift on what is important and how to live, how to deal with life and challenges that might occur. And then 2 other quotes, one on education. I appreciated school more than before the illness. Although I tried to learn what I missed, many aspirations did not align with the wish study. So I decided to take an apprenticeship. Could not be more grateful for this decision. So a change in plans, and at the end, he or she felt or was happy that he or she did something else than he would have thought before. Then regarding friendships, for the social domain, it showed me which friends really stood by me. It brought me closer to a lot of people, but I also lost a lot. But I feel this is positive because now I know exactly whom I can trust and who stands by me in difficult times. Another part of the survey was on met and unmet needs for psychosocial support. And overall, 4 of 5 survivors reported at least one unmet need. So a need they had and was not addressed so far. And on average, they reported on 2 unmet needs. So on needs in at least 2 domains. And again, the figure is built the same. Again, you have different areas: work, vocation, education, insurance, that we labeled with psychosocial areas, and then you have the psychological and the informational area. And again, red indicates unmet needs, gray indicates no need in this specific area, and green indicates met needs in this area. And as you can see, survivors reported most needs in the informational area, in the psychological area, but also regarding insurance and education. And also for vocation and work, there were quite some survivors that reported unmet needs. As I mentioned at the beginning, we did not only interview survivors, but also 3 experts from the legal and insurance area. And we mainly did this because we did not expect that many unmet needs and challenges with insurance. Because in Switzerland, insurance is mandatory and everyone will have it, can get it, but still it's a lot of survivors told us that especially this part was challenging, and they were very busy, and their parents as well, with these issues to try to solve them, to get what they need, to get what they would have basically could get. So we asked the childhood cancer survivors within the interviews we did, and the experts as well, on experiences with insurance, perceptions of discrimination in this regard, and needs and barriers for support to get rid of these problems they reported. And the quote I have on the slide, I think, summarizes quite well what we felt. What I think has stuck with me most of all are not the physical aspects, but the whole thing with the insurances. And this is, First, I was not sure if I should display this quote because it's quite long. It fills a whole slide, but I think it really explains very well from the perspective of an expert what might happen. What he says is that he experienced that some survivors first work full-time or work a certain percentage, and then they feel like that this is too much, that they do not want to or are not able to work that many hours or that many days maybe, and they reduce their workload, for instance, from 100% to 80%. But because that they feel like that they are not allowed or that they are discriminated if they do so, they do not report this to the disability insurance in Switzerland, but just do it and think, yeah, that's still fine. I work 80%, I earn enough, that's okay. And then at some point, maybe 10 years later, they recognize, oh, 80% is also a lot or too much for me. Maybe the family situation changes and they want to reduce to, for instance, 60%. And at that point, they declare this change to the disability insurance. But at this point, they reduce only from 80% to 60%. The first reduction was their choice. They would not have to reduce. And then the disability insurance only covers the 20% they have reduced in the second step. So I think this really illustrates nicely that you should on one hand, you should report, but more important that the system should allow you that you report it, that you do not have to be afraid of being discriminated because you feel like you cannot work as much as would be, let's say, expected from the society or from you or from others. This was the mixed method study we conducted some years ago, and where we have published the results. And based on this project, because we really did not expect that there are a lot of challenges regarding insurance and finances, and also with legal issues, we started a new project, and we call it the Shadow Project. And there we would like to investigate or focus on insurance, legal and financial hardships after childhood cancer in Switzerland. And based on the data we collect, we would like to provide evidence-based recommendations for the health and social security system in general, and specifically for healthcare, legal and insurance experts on how to work with these survivors and their families, and how to support them to not even have these hardships. And within this project, we have 3 different studies. First, and this is ongoing, we have a systematic literature review. So we search all the published research and will summarize what is there on financial, legal and insurance hardships after childhood cancer in survivors on the one hand and in parents on the other hand. And we will conduct so-called focus group discussions, so discussions with a small group of survivors and parents to ask them about such hardships. And based on these 2 studies, so based on the international literature that we will summarize and on focus group discussions with survivors and parents from Switzerland, we will have another focus group discussion with, we call them stakeholders, so with survivors and parents again, but also with experts and other healthcare professionals, for instance, being involved in follow-up care of survivors. And there the aim is to work on these recommendations, and at the end to have a document with all these recommendations on how to deal with these challenges. And with that, I would like to thank you, and I'm looking forward to your questions.
Thank you so much. Any questions for Katharina? You can still put them, of course, in the chat or the Q&A section. Or maybe we will come back to you in the panel discussion.
Sure.
Yeah, thank you so much for all this work. I think we are really looking forward to these recommendations. And yeah, I can only say there is so much to do, I think, because it really hits me seeing that, like, yeah, for example, the 54% negative impact on relationships, and so many areas with more than 30% negative impact. Yeah. So yeah, I really think that this is what we don't want to accept that.
Yeah, I agree.
So, yeah, a lot of work to do, but it's good that you already planned the next study and recommendations on it. So that's really nice. Okay, I'm just looking in the chat. Yeah, there is one question. Thank you, Katharina. Does the healthcare system cover psychologists?
To be honest, I do not know the details, and there was quite recently there was change in Switzerland. So far, only how is it called in English? Psychiater were covered. So yeah. Really, someone with a medical education could
psychiatry. Yeah.
Yeah, psychiatry could be covered by the insurance and the healthcare system. But as far as I know, this has been changed, and now psychologists can be covered as well. But I do not know the details. Yeah.
And also the question always is if it is possible in follow-up care.
Yeah.
Because we know in many institutions it is possible, covered by the healthcare insurance during acute treatment.
Yeah, but is it still covered, let's say, and, 10 years later? Yeah.
Really have to address this, and this is also, of course, a big area and a big task in the EU CAIAS net project to change this and move things forward. Yeah.
Yep.
Okay. So yeah, thank you again. And I think we just move on to a panel discussion because we really wanted to have a little bit more time today discussing these social challenges. So you already met Kerstin and Katharina and Tiago before, but I additionally want to introduce to our panel Patricia. Now I see you, Patricia McColgan. Hello, thank you for being here. You are a parent advocate and a passionate advocate for children, adolescents, and young adults with cancer and their families, and you're the director of Childhood Cancer Ireland. And I think it's really, as we mentioned before, we are strong together, so it's so important to also have the parent perspective in our discussion today. So thank you. And I'd like to introduce Ania Buchec to you from Poland. She is a rhabdomyosarcoma survivor and psycho-oncologist and patient advocate with a strong focus on quality of life for CAIAS and cross-border healthcare. She is also a member of the steering committee of Youth Cancer Europe and the founder of Fundacja Pani Ani. I hope I pronounced that.
That's perfect. Thank you so much. Also
an ambassador in the EU CAIAS net. So thank you for being here.
Thank you very much for.
Yeah, of course, I would have some questions and we will have our discussion now, but of course, please don't hesitate to put your questions in the chat and the Q&A section. So we want to stay flexible, of course. Maybe Anja, let's start with you. Hearing all those really diverse aspects of social challenges and the social dimension, what was your personal experience? What social challenges did you or do you maybe experience?
Thank you for asking that question. And I actually had to review it myself, and it's been so many actually. And it started from, I remember applying for as a 22-year-old for my first financing, and I did not at this point realize that I had to enclose my medical history, which I didn't see at this time as being a barrier or, you know, something that I should be hiding or being even ashamed of. Quite the opposite. I enclosed it, and I then quickly realized that, yeah, I would get my financing with a very high premium and a very strong life insurance, for which I would have to pay a super strong premium. Also, wanting to have an additional insurance. This was also not possible. It was simply not affordable for me. And then I started to realize the other part of the late effects, of the social late effects, I would call. Furthermore, then I realized also that keeping a job was very difficult for me. I mean, I did accomplish my studies. I finished university, I graduated, great, but I did realize that a full-time job was not possible. And on one side, at this point, I did not have all the tools. I did not have all the knowledge I have now or have collected in the past 10 years, where actually, as you say, the late effects, the right to be forgotten, mental health aspect was being openly addressed. Therefore, I was thinking, okay, that there's something wrong with me. So I was taking it very personally, and it was hitting my, my self-confidence very much. On the other side, I was accomplishing, I was 23, being a founder of a patient organization in Poland, and seeing the world and seeing the needs of how much needed to change. And it was such a, like a two sides of the story, basically. So knowing what I wanted to change or bring the change or address the changes and experiencing them myself, it was really a hardship. And it took a while for me to realize it's not only me, it's actually a majority of us facing the same difficulties. And it did make me feel better, but it still didn't reduce the hardship that we are facing. So yeah.
Thank you so much for
Thank you.
sharing. Can I also ask you what helped you the most? Did you experience any support regarding these challenges that helped?
Not at first. No, actually not. So in my, as I say, late. No, I did not receive any psychosocial support. And this time when I was in recovery or in my adulthood, the biggest help at first was just joining the Österreichische Kinderkrebshilfe and joining the survivors, then joining the different programs that were being offered, and also starting to look out broader what's happening around us. And also a great help was also the mentoring programs, where I actually could start and understand that the challenges I'm not facing alone. And it is so simple, yet so hard. And then I started to engage myself in the international work. And then I just didn't want it to have anything to do with cancer. And yet I was like leading two parallel lives. One, a normal career. I started to work in, in the corporate world. And then there was this cancer world, or post-cancer world, actually, that was dragging and taking me in, basically, in the right way, in order to address the hardship. Actually, I remember like 20 or 15 years ago, when you were talking about things like chemo brain, or naming them was abstract. At this point, I'm so glad that we have such an open communication. We are addressing on a national and international level psychosocial aspects, right? I remember when I started up the foundation 20 years ago, and it's actually called Psychosocial Support for Children After Cancer. And one thing, like, yeah, there's no need for that. You just healthy. What do they need afterwards? Quickly today, we do realize and we do know what young IS survivors need. And I'm glad we have projects like the EU CAIAS-NET, European-wide initiatives. I'm glad we can sit here together, have roundtables, have webinars like that, because this is really impactful. So yeah, it needed time, and those hardships are still here, yet the change is coming, and there are really good programs that have full impact. So yeah, Thank you.
Yeah, thank you. And I think already talking about all those aspects today makes a change, hopefully. Yeah. I was looking at you, Patricia, because you were nodding, and I think probably you can relate to also that it was just so different years ago, when nobody wanted to hear that psychosocial support would be needed.
It wasn't accepted, it just wasn't acknowledged. And I've heard so many times, and to hear all the young survivors speak up is absolutely my purpose in life to support this, you know, because this is the truth. It's your truth, and it's the truth, and it's the only thing that will change things, is when we speak up and speak out, you know. And even doing that, it takes longer than it should do, you know. And one of the things that I found hugely helpful, and we support young people, because we're an organization that was founded by parents, and like Childhood Cancer International, it evolved to have our survivors, and increasingly our future is our survivors will be taking the lead, you know. And one of the things I think that's really important is that there's an opportunity for people to engage in the way they want, because some people want to engage here, they want to speak up, they want to almost make it their profession, right? Other people absolutely don't want to engage in that way, but we need to have a community European-wide where they can come in the way that suits them. Just dip in, maybe just listen, learn a little bit, and I think that we need to make it a place for everybody, be they patients, survivors, siblings, parents. And I think one of the things that parents can do, and one of the things that we try and do as well, is to try and help the parents understand the transition. I think I used this expression earlier when I spoke with you before. In the beginning, when a child is diagnosed, the parent is driving the car. Then the child becomes a teen, and the parent sits in the passenger seat, and then they become a young person and they're in the back, and then the ideal is that we get out of the car. Yeah. So, but this doesn't happen by accident. So I think that one of the very important things is that we need the healthcare professionals and the parents to understand how to do a really good transition. Now, of course, the problem is many of our young people have nowhere to transition to. Okay, but even if they are transitioning to a position of self-advocacy in not a very efficient system, I think the idea of collaboration and us working together, and some of the things that we've done in Childhood Cancer Ireland is run advocacy workshops on self-advocacy, both for the parents and for the young people, because we all live in imperfect systems. And we engage with our community and said, what is that you want? So we have had general coffee mornings where people can just drop in. Sometimes we've had speakers in a more formal way. Then we go around to the country. I think it's very important, if at all possible as well, to meet people face to face. We have Zooms, they're fantastic, but there is no replacement for that moment, especially for the people who are not necessarily comfortable in this environment, to have that cup of coffee and to go to the different places around the country to sit with people. And some of the workshops we've done have been talking about parents about trying to get back to their futures and to help their children get back to their futures, and to acknowledge the trauma that people have experienced, and to give them a place to be engaged. And we have a parent peer support. We're fully trained. I think that's very important, that people are trained properly to do this, and that they work in partnership with the hospital. And just the other thing we do, and I see my colleague Evelyn from Canteen here, is we run a conference each year, and it's actually been really wonderful, because again, I'm mad about collaboration. I think it's the magic. Evelyn from Canteen runs a support group for young people 12 to 25, and collectively we run this conference each year, and it helps us bring political attention, and it puts the patients and the parents on stage. Nobody can refute what you're saying. This year, it was all about the psychosocial model of care that our country has just done. I'll give the link, and also about returning to education. And the other thing that we found very helpful, and this is something I say it because people can do it in any country, we've done a series of podcasts called Gold Ribbon Conversations. And they are from professionals, parents, young people, teens, cousins, siblings, bereaved families, all the people. And it allows, because people can access them in their own time whenever they want, it allows people to normalize their experience, to listen to other people sharing their experiences. So I'm happy to share a link there and see if any of these activities that we've been doing could be useful, because I believe very strongly that engagement, collective engagement is powerful, because it's a hard road, you know, and I think we need the encouragement from each other. And I find it hugely encouraging to be here today and to see so many people working to change things, and I thank everybody who makes this happen.
Thank you for all, this inspiration and the ideas and the resources. That this is really, again, working together and learning from each other, and then doing it together, moving things forward.
And the other thing Ania said there, recognized it, and my son has no part of this world. We have different surnames, so he's fine, right? No part of this world, never comes to anything, doesn't do anything. And I recognize this, Ania, when you were saying this, you know, and it's the struggle sometimes. And one of the things I'm always saying to the hospitals and to the people who are asking all the young people to engage in research, they have to come to meet you where it suits you. I don't mean physically, I mean mentally, everywhere. They have to make sure that, you know, they give you unrealistic deadlines. They don't realize that everybody's trying to, this is their paid work, you know, but this is your life and you're trying to fit this in on your life. And I think that we need to help them, and the researchers have a better understanding of the reality of young people's lives, and that if they want your opinion and your input, they need to understand you better. And they need to keep you updated when they're doing research.
Mm-hmm. Yeah, so important.
This is so box.
Also, I would like to add the question, because you know, we were talking about when is there has to be the right moment also to involve and so on. What else? Maybe Tiago, maybe you can comment on this, because you bring so much experience. What else would we wish from healthcare professionals regarding support? What can healthcare professionals do to improve support so that things change? And it's not that actually, as Anja, you mentioned, there was not so much, no support.
Yes, from my experience, I agree with Tanya and Patricia's testimonies, and I think that for what I've been seeing is that there is this lack of knowledge from survivors and from also the parents and caregivers, where to move on, where to find the answer to their doubts sometimes, where to go to the follow-up care as well. And I think that most of this kind of support for the social challenges is made by patient organizations, parent organizations, survivors organizations, and even the peer-to-peer support that survivors and also parents do to patients and other survivors. And my answer is collaboration between the healthcare professionals, the multidisciplinary teams, and the patient organizations and the survivors, because otherwise we will be like in a game to see where to see the best answer, where to follow up to see the right answer to that question that the survivor has, where to find the best psychological support that sometimes is in the patient organization, other times it depends on the country, is in the public health services. So I think it's the collaboration, and also between both the patients, survivors, and the health professionals to help to a better follow-up care, and to advocate for some topics as well. If there's something that could be improved, also, for example, in the follow-up care consultations and other topics like the financial discrimination and on the employment and education, for the survivor.
Yeah, thank you. So more ways to collaborate and also having this awareness together and share information, experience, and everything. Yeah, thank you. Patricia, you wanted to comment?
A quick question. Do most people automatically receive a treatment summary? And if they do, is it a treatment summary and a care plan, or just a treatment summary? And if it's a treatment summary and a care plan, what do they do with the care plan? So just to ask any of the of the survivors? I would be interested to know if it's normal to receive a treatment summary in Europe now.
Anya, Tiago, do you want to comment on that?
I can say that I received a treatment summary a long time ago, and not a survivorship plan. So what happens is that I go to a consultation once a year, and then yeah, it's not the best, but it's what I actually have, and in this consultation, it's like we do a recap of all the all the things that I complain, and we try to find the best solution. Sometimes it's not at the same hospital. For example, it can be on the other hospital, on adult services, for example, because I think there's a lot to a little bit we can change in this consultation that is done here in the Portugal for follow-up care. But in other countries, I know that they have, for example, the Netherlands, that they have a follow-up care plan and some recommendations as well and brochures. So I think that we can pick up these best practices and then to show them, and that's what we are doing now in the the Youth Cancer Survivors Network. We are doing a survey that I share with you now as well, and we are trying to map what are the follow-up challenges between the survivors that are answering this survey in Europe. So.
Yeah, thank you, Tiago. I also hope that with this survey in the EU-CAIAS-Net project, we will soon have a better overview on what is happening in all the countries and what can we improve, yeah, surrounding this topic. So maybe, yeah, Anya.
No, just shortly. I found a really good method of reported outcomes is we are running regular workshops for young IS survivors, and we have switched from what Patricia was saying. First, we were working with the survivors, but then we were inviting the parents on separate workshops. Why? Because so that we handle on tools to the young people that just basically trying to eager to live their life as much as they can with the challenges they're saying. So along the fact of sharing, being among each other and sharing in a working environment. So it's not just being together, but actually working towards tools, working towards a goal was a really, or is a really great method. So we have, the group therapy effect, we have tools, and then they come home to the same setting. So then we said, okay, this is working really well, but then we realized that we need to work on the parent as well. So we switched that, and then after each workshop for the AYA group, we are inviting their parents, and it becomes a fluid circle, because then really a change can happen. Then really a certain new experiences can be built, a new awareness of the social needs of sorry, that was my plug. That has really proven well to function. And another experiment was we have invited both their parents and the survivors, and both parties have said, no, we would like to have our workshop separate. And we have within a year huge changes within a peer group, especially also among the brain tumor survivors, that has resonated a huge change. So this is really a good model that works as well and highly recommendable. So
thank you so much for sharing.
Thank you.
And also having this experience, and yeah, we can take it and try and just do it. Yeah.
I mean, sorry, I have one more thing that I press as my, we are spending so much on treatment, And when you're considering for the insurance and strictly talking about money and budget, the amount spent on treatment versus the amount spent on psychosocial care afterwards in order to bring an individual to be work effective or be a contributor into the social system is inadequate. So in instance, let's just say we are investing 400,000-600,000 euros for a person of a treatment, investing another 20,000-30,000 would actually still prepare that individual to be a great contributor or a better contributor. So think about those measurements, or actually as a healthcare professional, perhaps take that into consideration, that investing another thousands euros in compared to the investment with the treatment is really, really worth investing.
Yeah, so true. I agree. Maybe that leads us to Kerstin. From your healthcare professionals' point of view, what do you think? What would be really the most important thing to minimize the challenges or to reduce them step by step?
I think it was already a little bit mentioned that the challenges all over Europe are a little bit different in the different countries, and that's why, especially for the social aspects, it's sometimes a little bit difficult because we all have a different insurance system, welfare benefits are different. The support service, for example, in mobility or employment and finance, it's always different in each country. So that's why sometimes it's a little bit difficult, and it would be great to find some best practice models in the different countries, maybe to see in which country the employment and support in work situation for the survivors is really good, or they already solve the right to be forgotten, or also maybe some project for a living situation to support the survivors in the aftercare, because there are also a lot of needs to support them in the housing situation. So I think maybe it's a good option to find some best practice models in the countries to see how it's working and how we include it also in maybe some other countries. And because, yeah, I think it's very important. And also maybe another aspect to the structural conditions. It's not that easy. Often it's already mentioned. Also, Katharina, you have a very nice example that we have to work on it, how we can solve the structural conditions, for example, in work possibilities. Yeah.
Yeah, I agree. Katharina, what learning from all the results you have and from your studies, what would your recommendation be? What should we do to minimize, to reduce the social challenges?
Yeah, I think what really was kind of impressed me, what the experts said we interviewed, that not a lot of people like them are really aware of childhood cancer survivors. They are, of course, in terms of there's a disease, there is childhood cancer and so on, but that this really has an impact on all these aspects of life, and that would be the best, that all involved persons are aware that there is this group of persons and what they need or what they potentially need. I think it is, you know very well, Kerstin, I think teachers, employers, people working at insurances, in finances, institutions, and so on. And I think if we all would be aware, then a lot of challenges could be maybe avoided or solved at a quite early stage, to not even have these problems. And yeah, also in terms of psychologists, it was asked if this is covered. I think this is one thing, but the other thing is that people working in hospitals tell us that sometimes there's not a specific psychologist available that is really familiar with these problems that childhood cancer survivors might face. Of course, they might be able to help in in a certain way, but really, I think being aware of these problems, challenges would be the way to go. Not an easy way, but I feel like this would help a lot.
And we all know it's really hard work. Although it actually would sound easy, you know, but we know
Exactly.
it's a long way to go. But at least, yeah, we started. I mean, and it was in the EU Chiasm project very often mentioned that we really do need more specialized healthcare professionals and yeah, integrated in the teams in follow-up care. Yeah. Yeah, thank you. Thank you all, the panelists and the speakers for your really, for all this input and inspiration. It's really enriching, I would say. And maybe this is a good time to also ask our audience one last question. So please put out your devices, mobile phones again, and Asta will show you the question, because we really want to know from you what should be different regarding social challenges in 10 years. Because it was really also for the last webinars so nice to have this word cloud in the end with all our visions, what we want to have in 10 years time, because really don't hesitate to write everything in there, because we really want to take this with us. We want to learn from it. We want to work on everything, work on it together, and move things forward. Now, I think now you can see the screen. Yes. So just what comes to your mind? What should be different regarding social challenges in 10 years? And we all know there's much work to do, but we want to get there. There should be more support, inclusivity. A lot of support and accessibility, of course. Support has to be accessible for everybody. Yeah, acknowledge the challenges, talk about it. Very nice. More understanding. Understanding is a big one. Education, the job market situation, we have to work on that. Thank you. Thank you so much. I know some of you are still writing. That's okay, because we keep everything you write in there. And as I mentioned, we take it every time for all the webinars, we try to include everything we have here in our task and really try to work on it. And we know not everything is possible like in weeks or months. Most of the things take years, but it's a start. Yeah, so thank you so much. I think we've reached the end of the webinar today. I really would like to announce the next webinars. You can see it here. The preview, so the next webinars will be on long-term follow-up care in January, and in February on transition. So we are really looking forward to that. And also, if you have not already done so, we really wanted to ask you again to fill out our survey. Both surveys are out there at the moment on long-term follow-up care and mental health and psychosocial care, because we really, we need your experience to move things forward. So if not already done, please take some minutes and fill out